Welcome to Dr. Balga's podcast for the Curious Doc. Today is May 22nd, 2026. This video is in a European Heart Journal article published 2 days ago on 20th May, titled Preservative Food Additives, Hypertension and Cardiovascular Diseases, the NutriNet-Santé Study. Food Additives and Heart Disease, the NutriNet-Santé Study. Experimental studies suggest preservative additives may induce oxidative stress, cytotoxicity, and vascular dysfunction. This is a prospective cohort from France, from individuals between 2009 to 2024. There were 112,395 participants, mean age 42.8, plus or minus 14.7 years. 78.7% were women. The median follow-up was 7.9 years. Dietary exposure quantified using repeated 24-hour dietary records with brand-specific additive identification and time-dependent Cox proportional hazard models. 5,544 patients had individuals had hypertension, and 2,450 cardiovascular cases were identified. What did they find? Higher non-antioxidant preservative intake was associated with hypertension, hazard ratio of 1.29, and cardiovascular disease, hazard ratio of 1.16. Total antioxidant preservatives were associated with hypertension, hazard ratio of 1.22. Additives like potassium sorbate, sodium nitrate, potassium metabisulfate, citric acid, erythorbates, and ascorbic acid showed significant associations. Limitations and key takeaways. Observational design limits causality. Residual confounding possible. These findings support minimizing ultra-processed foods rich in preservatives. Key takeaways: sodium nitrate and potassium sorbate showed among the strongest hypertension associations. Hypertension mediated 16.2% of the relationship between non-antioxidant preservatives and cardiovascular disease. Citric acid and ascorbic acid demonstrated unexpected cardiometabolic risk signals. Preservatives were common in processed meats, beverages, cereals, and packaged foods. No association with hip fracture negative control outcomes strengthened the specificity of findings. These results reinforce counseling towards fresh, minimally processed dietary patterns. This is an infographic of the study. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.